Hello, I'm Miss Tell It Like It Is. I hope everybody's doing wonderful. I am coming along great, working every day for progress. For all you knee replacement people out there, total knee replacement people, I'm just show you some quick little easy exercises you can do while you're laying in your bed. Okay. All right, let's get started. There's my leg, y'all. My surgical leg. My normal leg. As you can see, it's a big difference. Those are my compression holes. Okay? That's a big difference because this knee is not swollen. This knee is swollen, and that's expected when you had total knee replacement surgery, especially um, the kind of surgery. If you ever get a chance, go on YouTube. There are a lot of YouTubers, medical YouTubers that actually show the actual surgery. They're like doctors and stuff. And that is what my knee went through. So, of course, it's going to be swollen. And anybody else who went through that surgery, your knee's going to get swollen too, okay? The key is to take the pain meds um, and stay hydrated. Do the best you can. But I'm just going to show you these doing these foot warm ups. And it may seem so very simple, but this gets the blood pumping in the leg. Okay. You can do how many ever you want. It just depends on your body. Remember, take your pain medication, however it is, directed by um, the instructions, whether it's every 4 hours or every 6 hours. Pain control is very important. No, I'm just going up and down like pushing on a pedal. You can also, while you're laying in bed or even sitting up, you can do butt squeezes. Squeeze your buttocks as tight as you can for 3 seconds or 5 seconds, however you want, and then release it, you know. That helps your thigh muscles and your thigh muscles to engage with your knee. Okay, enough of that. It's just like pushing pushing gas pedals. Okay? See, once I get to total walking and stuff, and I get off the walker, y'all, I can start driving. You feel me? Well, I could probably be on the walker and then still drive, but I'm working, because hey, I gotta get on with my life, But first I gotta heal. That's important to heal. Okay, another one I'm gonna do is um I'm gonna bend my leg back, my surgical leg. Okay, let's look at my regular leg first. I'm bending my regular leg back, knee back, and then I'm straightening out, Bending it back, straightening it out. I'm just bringing it up. Okay. These are compression holds, you all. It's very important to wear compression holds after leg surgery. Some people wear compression holds after any surgery, but my doctor ordered some compression holds for me, and in the daytime, I keep them on. At nighttime, I take them off to let my skin rest. Okay, and it's important because it helps with blood circulation. Also, uh, it helps, it helps you from keep getting blood clots. Okay? Okay, it's early in the morning, so I'm a little sleepy. I'm not gonna lie. Okay, now this is my surgical leg right here. Let's see, bring it up. Bring it down. I'm gonna try to do 10 of those. Bring it up. Bring it down. 3, 4, and that's help bending the knee right here. 5, I feel it in my knee. 5, 6, 7, 8, 9, 10. And what I'm doing, this is active motion, you all. And active motion is when you're doing, your exercises on your own. Passive motion is when, the machine I've showed you in my previous videos, the continuous passive motion machine. That's passive motion. That's when a machine is doing it for you. Some people are against the machine because they feel like a lot of physical therapists against it because they feel like that machine does the work for you. And it does, but in my opinion, that machine still helps because it keeps your leg bending, okay? Yes, it's passive, but it keeps it bending. And because it keeps it bending, hey, that's good. And I feel like that machine for some people could help those, especially those who have trouble bending on their own. It can, help keep their leg from, worst case scenario, locking up. I'm sure that doesn't happen a lot, but it does happen, okay? It can happen. But we're going to stay on the positive side. It's not going to happen to none of us, okay? Okay, so I showed you that, and now I'm going to work on lifting my leg, keeping it straight. That's the hardest for me, you all. That's the most challenging. And also remember, when you are in your bed, laying down, sleep with your legs flat like this, okay? And the reason being is because this will keep the surgical leg healing straight, instead of healing like this. You don't want your leg to heal like this, y'all. You don't want your leg to heal like that. You know how you don't want to put a pillow behind here, and then when your leg is healed, you have you kind of have this little arch in your leg. So you want to keep your legs as straight as possible when you're sleeping, or if you want to elevate your legs to keep the swelling down, you want to put the pillow up under the ankles, okay? And you may want to put like two pillows horizontally straight and one pillow across, and sleep like that with your legs elevated over your heart, okay? Over your chest, okay? Or if that's too high, you may want to just use one pillow horizontally or vertically, vertically. Like my legs are vertical, straight up and down. You may want to use just one pillow up under, not your not your knees, but your legs. You may want to just use one pillow and put it up under your legs, and then put one pillow horizontally across. If you want to have it higher, two pillows vertically, okay, and then one pillow horizontally under the ankles, y'all, and the legs, not under the knees, okay? Because you don't want those knees to heal bent like this, okay? Okay, so that's if you want to elevate your legs to help with the swelling. Now, for me, I tried to elevate my legs like that. I just don't like it, y'all. I'm just gonna tell you, I don't like having the pillows under my ankles, because then my doggone legs, I can feel the stretch in my surgical leg. Now I may do it for exercise, but I can't do it like that all night. It's just very uncomfortable for me. But anyway, I'm gonna do on my non-surgical leg, I'm gonna do a legs lift, okay? See how I'm keeping it straight? 1, 2, 3. And I'm gonna start off with something small, because you have to do what you can do. Okay, it's not about how many you do, but it's about what you can do and you doing it right. Okay, it's not how many. You can start off with very little. You can start off with 3. Start off with 1, or let's say at least 2, y'all. Okay, but the leg ones is more challenging. Okay, I'm gonna try. I'm just gonna say 1, y'all. Whew, see, this is more challenging. Oh, 1. And it's challenging for me because I feel it in here. See, this is what I have to work on. 2. Oh. And I have to control how I control it coming down, but it's a challenge. 3. Okay, let me try it again. 4. See, I feel it up in the knee, y'all. I feel that pulling. 4. 5. 6. 7. 8. I feel that burning, y'all, and that pulling. 9. I'm trying to hold it, y'all. 10. Ooh, see, I controlled it there. Oh, Oh, I feel it, y'all. I'm not gonna lie, I feel that. But I have to work on that. And it may not look as straight because, it's swollen. Okay. And I still have, I don't know if you can see, I still have my sutures, after the staples is still in there. See, yeah, I have sutures under there. Okay. And basically, those sutures help, they help when the skin wasn't totally closed. Um, the nurse will put sutures there to close the flesh up. Also, it helps with the scarring. But I just wanted to show you all those simple exercises that you can do. Even if you don't have no knee replacement surgery, it's just good to do little things like exercising. My channel is about exercising. Um, I have walked on here and did a couple of exercises, but now because I have knee replacement surgery, um, it's all about gaining mobility back, strength and stamina, and being able to bend, and being able to keep my legs straight and being able to, just get back to where I was, but better. And I could do it. And guess what? I'm encouraging all of you people out there. You could do it too. Yes, I know. Yes, it can be very painful. That's why I say um, pain management. Take your pain medicine, okay? Don't. I mean, take it as directed. Don't overtake it. Even if you have pain, just remember that the pain isn't going to totally go away, but the pain medicine will, take off the edge of the pain. But you're going to have some pain that's normal. Always remember it's very important that you keep your incision clean, okay, and not drench it with water, but like, you know, maybe put a little um, I'll use a little Dow antibacterial soap. I don't scrub it. I just kind of pat over the area, uh, like slightly wet with some antibacterial soap. And then I take some clean water and I pat over the area with the clean water. Okay, and that's how I keep it, um, you know, clean. I don't put no lotions. Don't put no lotions, no scarring cream, or none of that until your doctor tells you you can. But you gotta make sure that it's healed. Don't, if it's itching, do not scratch it. That's just common sense, you all. You do not want to infect it, and make sure that you're, if when you take showers, some of you may take wash-ups, but for you all who take the showers, um, make sure you just don't get that incision just soaking wet. Okay, water can hit it, but just don't get it soaked in wet. Okay, and make sure that every time it gets wet that you pat it dry. Okay, make sure it's dry, and look for signs of infection. That would be any kind of ooze and pus. I know that sounds just nasty, but hey, any discoloration, any foul smells, because those are all are fever. It's all signs of infection. But I thank the Creator for me and you that will not happen. Okay, these are just things you have to look for. Okay, and those are worst case scenarios. But anyway, I'm just telling like it is. I just told it like it is. I love all y'all, and I thank y'all for those who do come to my channel, those who do support me, those who do comment. Thank you so much for your support. I really appreciate you. My channel is about encouraging people. Why? Because I care. I'm just one of these big hearted people that do care about people. And even though we live in a world full of ugly, cold, like narcissists, evil hearted, I'm going to say it, bastards, there are a lot of good people that still exist. They have good hearts. And I'm just one of them. Okay? So my channel is all about encouragement and being positive. I know sometimes I have some things that come out of my mouth that, may seem a little ratchet, but guess what? Hey, I'm not perfect, okay? But I just keep it real, okay? And everything, I keep it real. All right? Take care. Y'all have a wonderful day. Stay positive. Know that whatever you're going through in your life, you will get through it. It doesn't have to pertain to surgery. It's just whatever may be challenging to you. Okay? Stay encouraged. Keep going. Don't give up. Remember the saying I'm using my grandma saying, only the strong survives, the weak withers and dies. Who do you want to be, y'all? Do you want to choose to be the strong or the weak? Even when you feel like you weak, baby. Deep down inside, you are strong. Just come on. Reach down and pull it out, baby. Know you're never alone. Know your creator's always there with you. Okay? The key is to loving yourself. The key is to embracing who you are. Okay? The key is forgiving yourself of anything that you may have held against yourself. And the key is being self-aware of anything that you need to prove on in your life and admitting it and working at it slowly. Okay? The world wasn't built in one day. So, yes, we can't improve everything about ourselves in one day, but we can work on it piece by piece. And that's what Miss Taylor like it is. That's what I do. I work on myself piece by piece. Okay. Take care. I'm gonna say with my legs and my feet. Toodaloo.